Yes, I've read that you have been very instrumental in bringing about a lot of revolutionary changes in CBC exam patterns. And this is in line of you even introducing the concept of child psychiatry at a time when people didn't even realize that there are learning disabilities in children.
True. Mine was the, at that time, mine was the first thesis in child psychiatry.
The first thesis?
First thesis, yeah. In man's, mine was the first thesis. It's one of the oldest theses in child psychiatry. Now there are so many. My daughter is interested in child psychiatry, and she is doing work in child psychiatry now. Her thesis is in child psychiatry. But at that time mine was. But I didn't want to do child psychiatry because it's not very rewarding in terms of money. You can see 5 adults by the time you see 1 child. But then I realized there is a lot that you can do at a time when people are hesitant to bring a child to a psychiatrist. Can you imagine taking a child to a psychiatrist in 1981?
No, definitely not.
Definitely not. Even today it's so difficult. So, but because these are neurodevelopmental disorders, an ADHD child is not just a piruvirupan. ADHD child is a piruvirupan because the dorsolateral prefrontal cortex in his brain is not actually executing enough amount of control and inhibition so that the child is able to sit down quietly for an adequate period of time to be able to learn a task. And this is a neurodevelopmental disorder which can be controlled with medications to some extent, and which can be controlled by good parenting, which doesn't exist in today's society. So, which is another the sort of concepts that are coming up about parenting. It abolishes controls. So these are things that we can do, which I have pioneered. Even today, that these are things that I talk about. If we talk about my rebel part, you know, if you look at my life in, say, Trivandrum Medical College. Trivandrum Medical College, when I went there, there was a lot of hesitation for people to have youngsters, especially those who are from outside Trivandrum, to become, president of the college union. It was all, there was no party politics at that time. It was all basically individualized. As an individual, you can be elected as a president. And then I stood for election. I didn't actually go out to work. I was having my university examination at that time. And that's what the time when I realized, you know, the internal marks were 75% of your total marks for it to enable you to pass, and 25% was external. So even if you had done extremely well in your final examination, you're not going to get through because your internal assessment based on your relationship with the boss, with the unit chief or the head of department, that will actually reflect on your internal marks. So we all got together, and I was at the Arrowhead, and we had, I remember the days when I fasted in front of the university, and we had a university decision that came afterwards that it will be 50-50. You all must have gone through this 50% internal, 50% external, right?
Yes.
Yeah, you've been lucky. We had to fight for it.
We should thank you for that as well.
One of them, it's not, it's collective, it's absolutely collective. But what I'm trying to say is, you know, I cannot be rebel, but the collective consciousness I have created wherever I go. Wherever I have gone, wherever I studied, where I worked, in any specialty or any place I worked, I have created a collective consciousness. Even this, what that I'm talking about in terms of the society's demeaning, treatment of the medical doctors in this community. Even that is trying to raise the collective consciousness of this community, correct?
Sure.
I did that, and then I realized, you know, once you get into medicine, you have no life at all. So as a president, I organized the medical students of Kerala.
As a president of IMA?
As the president of Trivandrum Medical College.
Okay.
As a president of Trivandrum Medical College. It's way back in 69, when your father may not have been born. Right? So 71, 72, we organized the students of Kerala, medical students of Kerala. So there can be a collective consciousness about many of these difficulties that we were finding, including hostel facilities, including so many other things. So we got together, and then we had a coming together in the first Intermedical Youth Festival, which I started. I was the Secretary General of the Kerala Medical Students Association. I actually produced its bylaws. And we had this Kerala Medical Students. I conducted a 1 month long medical exhibition, and we had a whole lot of, we had a huge number of people coming in there. Nobody wanted to stop this because so much money coming into it. We donated all that money for a stadium in Trivandrum Medical College. So those are all things that I have done. I realized there is so much of, you didn't have to go through Gray's Anatomy and Best and Taylor to pass your MBBS, first MBBS. We had to go through Gray's Anatomy and yeah. So I realized, there is a need to look at curriculum revision. And the university was good enough, especially Professor Dr. T.B.K. Menon, was good enough to organize a curriculum committee revision with Dr. K.N. Pai at the top and Dr. Francis, Dr. Madhavan Gutti all in the committee, and I was the convener of the curriculum committee. Being a medical student, they thought it was sagacious to include a medical student in the committee. So those are the days. Those are things that I have done to arouse the collective consciousness. And then I went on to NIMHANS. And at NIMHANS I found that we had huge amount of difficulties as a medical person, because NIMHANS at that time had a concept that every department is the same. That your medical department is the same as psychology department, is at the same level as the psychiatry social work department, etc. And I had clinical psychologists, chiefs, who would strike off what a medical doctor had written. So I told her, this is not done. You can't touch that. It has a sanctity to it. I was taken, in fact, we had to actually again raise the collective consciousness. I said, you have to have hierarchy. One of the basic principles on which I've built my life, my career, my home, my family, is all based on the concept of hierarchy. In fact, the universe exists on the concept of hierarchy. You have black holes and you have galaxies. You have black holes who can swallow up tens of galaxies. But see, they don't swallow it up because there is a personal space that you keep. And if you don't have this personal space, then we have a problem. So if clinical psychologists tend to practice psychiatry and start writing medicines, then there is a problem there. These are girls and boys who have taken humanities, which has nothing to do with the science that you are talking about to go for medicine, correct? But once they do their psychology, then they start to prescribe medications, is that right? So I said no to this. And there was this huge problem in NIMHANS. They were planning to suspend some of us who are the spearhead of this movement. But it didn't work out because, there is a justice that will ultimately be provided. And we had justice today, the same system. I just rang up my daughter today to find out whether that system still exists, where, patients who come are not primarily seen by non-medical people. That used to be the case when I was there.
So
and that we changed. We changed.
Right, you didn't back down.
We didn't back down. I put my career on line.
Okay.
I could have failed my MBBS because one of my professors told me, you should remember that you have to go through these 5 fingers to take your MD. I put my career on line because I was not asking for increased remuneration. I was not asking for better hostel facilities. I was not asking for anything material. I was just asking for change in the hierarchy. That's all. And today we have it. Many people as individual psychiatrists may not have it, but that is their failing.
I don't think most people actually understand the difference between psychology and psychiatry. I mean, today psychiatry is a point of intersection of physiology, psychology, spirituality. So can you differentiate between psychology and psychiatry for the audience?
It's not easy actually, but if you look at clinical psychology and psychiatry, psychiatry is a medical branch, and clinical psychology is a non-medical branch. When you pass 10th, you go into your +2. And if you are a great doer in 10th, you go and take your maths and
Science stream. Yes.
science stream. If you don't want to do that, then you go for bio, which only fools will take. Because ultimately, if you want to become a doctor, you're doing a terrible mistake, because you're going to get beaten up by the society. If you don't want to do that, then you go for commerce. If you don't fit there, then what do you go for? You go for humanities. And then you take a degree in clinical psychology, which is a non-medical degree, correct? But you always invariably go for a PhD and you become a doctor. There are difficulties with this, because we have any number of people, especially not in Kerala much, but in other states, we have any number of people who prescribe medications.
People, you mean those who are not psychiatrists?
Not psychiatrists.
But psychologists.
Psychologists. I'm not saying psychologists, clinical psychologists.
Okay, but essentially they are not allowed to prescribe.
Absolutely not. How can any non-medical man be allowed to prescribe medications?
What is the boundary that is set?
The boundary, there is no boundary. The boundary is that there are medications to be given. These are psychopharmacological interventions. Medications to be given for people whose brain functions are not normal. And that's what psychiatry is. Psychiatry is the application of basic neurosciences to human behavior and problems, emotional problems, behavior problems, character problems, personality disorders. They don't just go away by counseling. People don't understand what counseling is. Our medical profession is the worst. If somebody goes to a physician with an 18-year-old daughter, he would say, why do you want to take her to a psychiatrist? Because he is increasing the stigma, saying, why do you want to take her to a psychiatrist? She has to be married now. So he puts her on an anti-anxiety regimen. The problem would be depression, which is very sad. Because I feel that I beg the pardon of the medical fraternity for this. But then there are many physicians, because whose consultation requests I see, who think that this problem, kindly do counseling, kindly give counseling. What is counseling when you need medications? So most of the psychiatry that many physicians learn are from the publications from Cochin or Kottayam or Calicut. So what do? Manasasana marabadi. ഡോക്ടറെ ഞാൻ അടുത്ത വീട്ടിലെ പെണ്ണിനെ സ്നേഹിച്ചിരുന്നു, ഞങ്ങൾ അവളെ എന്നെ തിരിച്ച് സ്നേഹിച്ചിരുന്നു, ഞാനിങ്ങനെ SMS അയക്കുമായിരുന്നു, ഞാൻ വാട്സാപ്പ് അയക്കുമായിരുന്നു, അവൾ റെസ്പോണ്ട് ചെയ്തിരുന്നു, ഇപ്പോൾ മിണ്ടുന്നില്ല ഡോക്ടർ, അവൾക്ക് മറുപടി അയക്കുന്നില്ല ഡോക്ടർ, എന്നെ കണ്ട് നോക്കുന്നില്ല ഡോക്ടർ, എന്നെ കണ്ട് ചിരിക്കുന്നില്ല ഡോക്ടർ, ഇത് കാരണം എനിക്ക് ഉറക്കം വരുന്നില്ല ഡോക്ടർ, എനിക്ക് കോൺസെൻട്രേഷൻ പറ്റുന്നില്ല ഡോക്ടർ, പഠിക്കാൻ പറ്റുന്നില്ല, രോഗമാണോ ഡോക്ടർ? നമ്മുടെ ശ്രീനിവാസൻ ചോദിച്ചില്ലേ, ഇത് രോഗമാണോ ഡോക്ടർ? അപ്പോൾ മനഃശാസ്ത്രത്തിന് മറുപടി വരും. ഇതാണ് നമ്മുടെ സൈക്കാട്രിസ്റ്റിനെ ഒഴിച്ച് ബാക്കിയുള്ള മെഡിക്കൽ പ്രൊഫഷനിൽ ഒരുപാട് പേർക്ക് അറിയാവുന്ന സംഗതി ഇതാണ്. So where have they learned?
From the columns that you see in magazines.
In magazines, not for the 2 weeks that have been allocated for them to go to psychiatry department in undergraduate medicine, correct? It's so sad because of that lack, they treat all psychiatric disorders. If you take a neurology consultation, at least 30 to 40% of their consultations are truly psychiatric. A general physician, for example, a GP, for example. It's good that they do this. I'm not against their doing this practice, but they should do that practice after understanding what psychiatry stands for today, not 10 years ago. Today, psychiatry has changed. It is neurobiology. As I said, it's genetics, it's epigenetics, it is neurobiology. It's about neural circuits, it's about neural networks that comprise of hundreds of neural circuits, and about the phenomenology, the symptoms that are related to these neural circuits. That's why it is always said and taught. There's a great man called Stephen Starls who said the destiny of dysfunction in the brain, that depends on your understanding of the neural circuits. So you have to have maintain an up-to-date understanding of how the brain functions for each of these functions. Attention, concentration, the ability to read, write, understand what you read, to write what you know, to use language as I'm doing. As I'm talking to you, the ideas are coming into the right brain. The signals go to the left brain across the corpus callosum, which is a bridge separating the right brain and the left brain. It has to go to the lexicon where the words are stored. It has to go there and keep on picking up the words that will mean exactly what I think. That
All this within
a fraction of a second, that's true. And the signals have to go there, put the words into sentences, and sentences have to be put into order and sequence and then expressed. So language is part of neurology, it's part of psychiatry. So these are all basically tension, sadness, anger, frustration, despair. All these are, as I talk about in association with the concepts of the Gita. These are all created by the Lord. These are all sitting inside your brain cells. And it's a mode of how this is expressed in each individual that determines whether somebody is normal or abnormal. Correct? So we have to actually think of the medical model first when you're thinking of disorders of the mind. Here, what do the physicians do? What do the neurologists do? What do the pediatricians do? They send the cases across to psychologists for diagnosis and for management, if it's possible, by counseling.
You're talking in terms of autism and ADHD and
everything. Even if it's depression, for example. The actors and actresses that we see, many of them have mood disorders, and they're treated by counseling. Deepika Padukone said she went to 3 or 4 counselors and therapists. She was dejected. She said in a week after starting medication, she started feeling better. And then she recovered. How do these things happen? Problem with this is, psychiatric medicine, even there are many doctors who say, absolutely not. Today's medications are not. See, there are people who, in the wrong hands, it can produce all these things. That's true.
Yeah, every coin has 2 sides.
Every coin has 2 sides, and every physician has 2 sides. One is a side of competence, and the other is a side of incompetence. So I am saying, if you use these things judiciously, sagaciously, then you will find good responses to your treatment. And it's not about walking around like a zombie. It used to be the case when the first generation antipsychotics were being used. Today you are into 3rd generation antipsychotics. And psychiatry is the youngest branch of medicine. It's a branch of medicine, it's the youngest branch of medicine. And it is only now that we are seeing where the mind is. In my time, we didn't know where the mind was. It is only guesswork. Today, because the exponential growth of neuroimaging, we are able to peep into the live brain cells and find out what is happening in these cells when I am getting angry with you, or when I am getting sad. So basically, these are controlled by neurosystems, which can now be viewed. From about 18 years ago, I used to say, because you are asking about autism, these are some of the pioneering things that I have done. There is much more left to do. Neurodevelopmental disorders. The next 10 years of psychiatry will be defined by the pharmacological treatment, that the medicine's treatment of neurodevelopmental disorders like learning disorders, autism spectrum disorders, communication disorders, coordination disorders. Next 10 years. Because we already do it. We are already into it. The problem with, for example, autism, because you raised autism. Autism industry is the biggest industry in Kerala now, in psychiatry. Because there are a lot of the centers with speech therapy, behavior therapy, ABA therapy, this therapy, that therapy, physiotherapy, all these are there. But they don't do anything unless the connectivity in the brain cells is improved.
Why do you call it an industry, autism industry?
Because there are so many centers. I have a chappie who, they were staying here, they came from Canada for the treatment of the child, Malayali family. They were staying in Cochin for 1 year now. The child has not made any improvement. They were being charged 45,000 rupees a month for ABA therapy, behavior therapy, speech therapy, OT therapy, and physiotherapy. All therapies don't work unless the connectivity increases, because autism is a disorder of the lack of central coherence, which means the connectivity across brain areas through electrical circuits. That has to be corrected, no? And we have medications to correct it. Why people keep on saying there is no treatment for autism is because their centers can sustain, and two, they don't understand that autism, in 40% of autistic children, they have mental retardation or intellectual disability, as it is called today. So children who are mentally retarded, you cannot correct them by any of these treatments, nor by medications. So they say that, you know, this is not treatable. So then what is your option? You go for these therapies, so that you take the guilt away that you are not doing anything for the child. You spend a lot of money, you're happy.
So in your words, autism oru paridhi vare treatment ലഭ്യമാണ്, and it can be treated എന്നാണോ sir പറയുന്നത്?
Truly, if it is autism, if it's rightly diagnosed as autism, who diagnoses autism? If a case is taken to a pediatrician today, the case is not sent to a psychiatrist, because psychiatry കാണിച്ചു കഴിഞ്ഞാൽ കിറങ്ങിയിരിക്കില്ലേ, കൊച്ചുങ്ങൾക്ക് മരുന്ന് കൊടുത്തു കഴിഞ്ഞാൽ ഭയങ്കര കുഴപ്പമില്ല, ഫുൾ ടൈം കിടന്ന് ഉറങ്ങില്ലേ, ഇങ്ങനെയൊക്കെയാണല്ലോ ധാരണകൾ. അപ്പോൾ സൈക്കോളജിസ്റ്റ് അയക്കും. You look at all the teams that there are in multidisciplinary hospitals. They have a psychologist, a speech therapist, an OT, and the cases of autism are sent to them, not for medications. And I have a 5-finger approach to. I'm not saying autism is to be treated by medicines alone. You have to have multi-pronged strategy. I talk about a 5-finger approach where my thumb, without which the hand cannot function, my thumb is my discipline, because autistic children have to be functioning in a structured environment. If you look at your 8th standard or 9th standard teachers, you will find that in the class of the teacher who was firm and strict, you learnt well, not punishment. I'm not talking about punishment. No shouting, no yelling, no screaming, no pinching, no beating, no bribing, no bully. Without all these, you institute discipline, which is a structured environment that an autistic child needs. And then you have communication difficulties. And after that, you have language, verbal language, which is dependent on the connectivity across brain areas. As I said before, when I think, the skills have to go there and the words have to be picked out and brought out. That doesn't happen in autistic child. And you can actually increase the signal speed by using medications, if it is pure autism. Am I clear? Yes. But instead of that, if you keep on doing this for 3 years, like this child who has been here with the center for 1 year, they have not gained anything. Yesterday, that mother, she was sitting there and crying that, you know, because they have to go back in January. She's saying, we lost our time, because child is already better. 6 weeks of treatment, child is already better with medications. So you have to have a 5-pronged approach. You have to have discipline, which has to come from home and from the centers. Appan friend ആണെന്നാണല്ലോ പറയുന്നത്. അപ്പം ഫ്രണ്ട് മക്കൾ നേരെയാവും. And you have communication strategies which are non-medical, by a language therapist, not by a speech therapist. Speech is the monitor. The CPU is, the central processing is the language. That is where the defect lies. Most people think this is a speech problem. It's not a speech problem. Speech is a monitor. Even if it doesn't work, you can fix it. A central processing CPU cannot fix it unless you work at the central processing signals itself. And that's what you get by the case being seen by a psychiatrist, not by any other specialist. There's something called the F block in the International Classification of Diseases. F block is in psychiatry. F block is psychiatry. G is neurology, for example. This is a WHO theme. But unfortunately, our government and our specialists think that, you know, it is stigmatized and fearful to go to a psychiatrist. So they are taken to every other specialty than psychiatrists, under which this is included actually. All neurodevelopment disorders are to be treated by psychiatrists. F80 is the ICD. F80 is communication disorder, language disorders, speech disorders. F81 is learning disorders. F82 is coordination disorders. F80 for autism spectrum disorders. These are all come under F block, which is psychiatry. Unfortunately, now everybody has taken off psychiatry, taken away psychiatry. So this is our boundary disputes with our fellow specialties. This is another area where I have been a so-called rebel, because nobody else will talk about this. Why do you want to antagonize other specialties? I am not antagonizing. In fact, as I said, the work in child psychiatry, I was also part of the pioneering work in child psychiatry in Cochin. The Child Care Center, which was started by the Indian Academy of Pediatrics, Cochin branch. If you ask people like Dr. Abraham Kapol and Dr. Sachidananda Kamath, they will all recognize my initiative in this. And M.K. Sinayar, who was also at the spearhead of this movement for disabilities. I don't think it is a disability. Disability is where there is no response to treatment. Disorder is where there is a response to treatment. That's why we have called it a disorder, autism spectrum disorder. But intellectual disability, because the mental retardation you cannot change. And we started this child care center. But then a little while later, when I came back from Dubai after a short stint there, I started our own center, which is a child guidance clinic. And that's where my knowledge expanded, because of the experience of having dealt with thousands of children. And subsequently, we developed some of these treatment modalities for learning disorders, autism, neurodevelopmental disorders. And that's how many people consider that I have pioneered child psychiatry, especially in open practices, office practice system. Everywhere else it is actually within the hospital system. I function in an exclusive system where, it is easy for somebody to walk in and get a consultation or fix an appointment and get a consultation. So what I'm trying to say is, these are all possible if there is a rebellion in you, which will make you think out of the box.
An inherent desire to question.
Question and find answers. It's not just question. It's not like the evening channel discussion, which is all questions. You need to find answers. So answers come by, when you go to Google Doctor, everybody goes to Google Doctor. I give you a prescription, you will definitely look at the Google Doctor. And the Google Doctor's problem is, he is such a confused man himself. He doesn't know which is right and which is wrong. But our next generation and the idiotic among them, they will go to Google Doctor and ask. Those who go to Google Doctor, they have a problem with their trust levels, and therefore they look at the negative things first. If I prescribe a medicine for some people from another part of the state, the first question is, Doctor, is the side effect in the That's the first question. They don't want to know what benefit it is going to give them, but the side effect in the that's the first thing. What is there in this life without side effect? Even my conversation with you has a side effect. Right? A lot of people are not going to like it. But those are facts. The fact is that somebody will benefit if we have the collective consciousness of resisting the sort of anomalies that are taking place around us, including psychiatry being pushed out of the mainstream of medicine, which is very sad, because psychiatry is a branch of medicine. Psychiatrists are primarily and unambiguously physicians. We are also part of the problem, because we don't understand, we don't take a great view of neurology, for example. Psychiatry is neurology. Unless you learn a lot of the basic neurology, you will not be able to be a good psychiatrist. And in fact, you will benefit much more by learning neurology than psychology. But unfortunately, in our system of curriculum, there is more psychology than neurology. What do you do? Because, it is all actually, I feel there is an agenda behind it. Because when we were students of psychiatry, we had 6 months of posting in neurology, and we were taught exactly like the neurology residents. So it's not because I want to be a neurologist, but psychiatry is neurology. That's why neurologists are practicing psychiatry. There is a study in New England Journal of Medicine. It says 40 to 50% of all general practitioners' cases have a psychiatric diagnosis, right? you'll find that it's much more here, because there is a stigma about sending somebody to a psychiatrist. To me, 60% of any some of the associated specialists, because they take away the psychiatric cases. For example, everybody thinks a pediatrician knows much better about a child's learning disorder or hyperactivity than a psychiatrist, for example, to whom you take only a madman. My child is not mad. When they don't realize this is something that's part of psychiatry, because of evidence created across the world for decades, today we know that how they are produced, and this has rightfully fallen under the psychiatry spectrum. But then they are sent to, they don't treat. You see any of these neurologists treating learning disorders, except writing methylphenidate?
So you're saying the medical fraternity itself has to be first educated?
Absolutely. There is no point in education, because they learn it when they are doing their specialization. They don't look at it because it's not going to be asked for the examination. But now they find after infectious diseases, now there is a dearth of infectious diseases in terms of the number of specialists there are. So everybody has to have their meal on their table, right? So we are attacked just like doctors in this society who are soft targets. Psychiatrists are soft targets. Because everybody used to think, the fellow who goes for psychiatry is mad himself. Right? And they feel that, the psychiatrist, he doesn't get admission for any other specialization.
And hence ends up...
And therefore ends up doing psychiatry. Right? I chose psychiatry. I chose psychiatry because I had actually an argument with one of my professors in medicine. I said that's the only branch which requires intelligence.
Can I quote you? Are you saying psychiatry is the only branch in medicine that requires intelligence?
You can't quote me, I'm going to be taken apart. But what I'm saying is, this is about understanding what goes on in your brain without you telling me. You understand? Because what are our tests? Nothing. It's only what goes on between the two of us, correct? My EEG cannot give an answer, my MRI cannot give an answer. If I go mad, then you will want to do all these things on me? No. You will check me with your questions. Right? So you have to have enormous amount of what we call the mirror neuron functions to understand what is happening in your brain without you having to tell me. So you don't just speculate. That's why psychiatry is thought of as a speculation.
So you're saying it's not?
It is not. It is not speculation. It is precise neuroscience. It's precisely, I can prove to anybody who wants to get into an argument about this, I can prove that this is a precise neuroscience. Only thing is, it is only the beginning of its exposition. We have just started. 10 more years, as I said, neurodevelopmental disorders and neurocognitive disorders, things like dementia. Dementia is actually part of neurocognitive disorders, which is to be treated by psychiatrists.
And not a neurologist?
No. I don't know what my neurology friends are going to think of me. But that is a fact. F0 to F9 is neurocognitive disorders. It comes under psychiatry, the block F. But then who would want to take an annoying father to a psychiatrist when the son thinks that he may be branded as a psychotic? So it's about thinking about the collective consciousness and not being a rebel, but thinking about the collective consciousness and to move towards what is truth.